Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, hello, Metro Detroit. This is Dr. Joseph Kanu from Simple Truths for Healthy Living Live.
Dr. Jeffrey Haddad here of Rochester Advanced Dentistry as well.
Yes.
Looking forward to another great show tonight. I've got some special things planned tonight, as always.
Great show.
We got on a roll last week. For those of you who were listening, we were talking about early intervention with children. And how, a lot of times, we've
love that one.
Well, it is. It's the saying of, missing that growth and you're ending up repairing things is very, very true. We watch these children and you can watch them and you can hope they develop properly, which unfortunately a lot of people in the dental world do. But then they reach that age of 12, where we learned last week, 90% of your child's face is already developed at 12 years of age. And if there's something hindering that development,
well, you want to gently guide it and assist it.
You got it.
To a normal bite, you were saying, and normal function.
Normal function.
As the whole body, not only your teeth, your spine,
correct,
your knees, your pelvis, before you hit 12.
Correct.
That's where people don't take their kids to the dentist in the old days.
Right.
Nor do they I struggle that in our field is, hey, if your back doesn't hurt, hey, if it ain't broke, don't fix it. Well, problems are starting.
Right.
Developing.
Well, and I like what you said. I mean, a perfect example, person walking around with a bad hip, a hip that's displaced. Well, the body accommodates, right? We accommodate, and, you walk funny for a little bit, and then all of a sudden you walk normal because your hip's displaced, you offset, you walk a little funny, and then 10 years down the line, you need a hip replacement. You're like, well, how did this happen all of a sudden?
Right.
It didn't. It wasn't taken care of at the proper time, and things progressively got worse, escalated. And so,
we love the word exacerbation.
That's a great word. You've been throwing out a lot of $2 words lately. Yeah. I like that.
Hey, now Jeff, we got a caller on the line. We haven't done our prayer.
Okay.
So what should we do here?
Well, I'll leave it up to you.
Okay.
Is our caller going to be patient for us?
Caller, can you, whoever it is, please hold on 1 minute.
All right.
We haven't started the show yet.
Well, everybody's so excited to get going here.
Listen, let me see. This is from Romans 13. Obedience to authority. Let every person be subordinate to the higher authorities. Man, I have a problem with that. I struggle with this one. I need to read this every night.
Struggle with authority. Yeah. I know.
I don't want to be subordinate. I don't want to bow to anybody.
We're going to change that for
you. Well, we
are
not to bow to anybody, but for there is no authority except from God, and those that exist have been established by God. That's like some of the kings in the past, the Israelites, God gave them a bad king because they were subordinate and bad, and almost God did it to punish them.
Yeah.
But anyways, and that's what we need to do sometimes to our doctors, people who are in authority.
Yeah.
Isn't it?
It's true.
But people in authority like us, we need to guard our words. And we ask, Lord, that you would guard our words and guide our words as all doctors in the whole Detroit metro area, all the physicians, that you would guide all of them. Give them wisdom and skill and ability and discernment, and as they treat their patients and work with the patients together for your glory, for you are the true physician. In Jesus' name, amen.
Amen.
Okay.
Well, no, I think that
caller. Okay.
Well, I was going to say,
sorry.
the fact that we are trying to educate our patients, a lot of times it's things that they don't want to hear, and
Sure.
and
or it's hard for us. We want to tell them, hey, everything's okay. Come back in a year or whatever.
Sure. But you also have to be honest with a patient,
honest,
and let them know. Listen, if you choose to do something differently than I'm recommending, or nothing at all, that is your prerogative. That's your decision. But it's my job to let you know what the repercussions can be, and that's really what tonight I want to talk about. Is because if you do not have your children evaluated early on, and you do wait and think, oh, it can be fixed later on, I want people to understand what the possible negative consequences can be of that. It can result in pain. It can result in unnecessary or unavoidable surgeries and some big health issues in the future that can be completely avoided if we intervene early enough with your children. And we touched on it last week, and we got going. And I really want to get into the
want to cover that.
I want to get into the bulk of it
today. There's one call. We got to take this caller though. It's Marcia giving us an update. She trumps your start of this now.
That's okay.
Marcia,
I want to hear from Marcia.
Hi, Marcia.
Hi, Dr. Joe. Hi, Dr. Haddad.
How are you?
Hello.
Oh, I'm hanging in there. I'm thankful that you
let's
Bible first and to prayer first before you took my call.
Thank you for being patient.
The update that I have is I had those 2 teeth pulled, and I had 2 dry sockets and an infection. So I had to go to the hospital, and they gave me clindamycin, and of course there was a lot of pain, and they gave me a pain reliever I will not take because I'm too scared to take it. But I thought I'd let you guys know that I'm feeling a lot better, and that good stuff.
That's good. You just got to get kind of over this hump here, Marcia. Unfortunately, with any procedure or surgery, there can always be post-operative complications, and we do everything in our power to avoid them. And sometimes it's not even part of the procedure itself. It's the actual person's body that's not responding well to the treatment, and we have to kind of get your body on the healing pathway. But it sounds like you are, and like we talked about last week. I mean, this is something that once things do calm down and heal, you can move on to the next step, which is rebuilding things and replacing those lost teeth. Because like we've talked about many times in the past, Dr. Joe, I mean, losing teeth is a big domino effect. You may be able to still eat fine to a degree. Maybe you have to modify things a little bit. But what can happen in the future, and we just touched on it before, the negative consequences in the future are you losing more teeth because teeth are moving into those spaces, things are shifting, and then you have to have future teeth taken out. And then we are getting into a situation where maybe your eating is affected, and you can't eat the nutritional things that it sounds like you want to eat anyway. If you're staying away from narcotics and things like that, you obviously care about your body, Marcia.
Right.
And taking care of your teeth, making sure that you're able to eat the proper healthy foods that give you the proper nutrition is very important. So I'm glad you're feeling well. We appreciate you calling and give us the update. And when things, continue.
What's her next step, though, Jeff?
Well,
she's gotten through Marcia, you're pretty much through the dry socket phase, right?
I think so.
Well, if I can tell you are if you're feeling good, okay? And so that's, things are healing. You have some options. Obviously.
In other words, if she wasn't, she'd have pain. She'd know if she
would know.
Not.
Yeah, there's no question about it. There's no question.
Jeff, we need to cover a show maybe on how to naturally treat a dry socket.
Well, I know
you do the tea bags, maybe some aloe or something like
that.
Well,
there's a lot of things. Once a dry socket, it's a word that gets thrown around a little bit too. A true dry socket does need certain type of medicine involved locally. Sometimes an antibiotic, like Marcia's talking about too.
How about your laser? Do you ever?
When it comes to a dry socket, that's not really going to help. What we do and what we can talk about is how to avoid a dry socket, because there's a lot of things that you can do to
There you go again with prevention.
Well, I
You're
want to
always
prevent
trying
things.
to prevent things.
I want people to avoid.
I don't know if I like that about you.
I would give anything, Marcia, to have given you some tips maybe to avoid this, because I'll tell you, I have been there in so many tooth problems in my time. I mean, we've talked about it in the past. I mean, I've had the toothache that I didn't know if it was an upper or lower tooth. It was that bad, and needing a root canal. And I've had an abscess in the past. And so, I'm very obviously compassionate, but I'm very empathetic to my patients because I've gone through some of these horror stories. And tooth pain, you don't wish it upon your worst enemy. It's unlike anything else, and it's one of those things that we want to prevent. If it does happen, like with Marcia, then we want to take care of it as soon as possible, get our patients comfortable, and get them back on the right track. And to finish your or answering your question about what the next step is, well, Marcia, replacing teeth, we've got options here. You've got a fixed bridge, okay, which means that we actually utilize each tooth on each side of the space, and we cement a crown on each of those teeth with a crown that's connected to it.
Sure.
So it's literally a bridge. You're bridging the gap.
So you have an opposing force on the opposite tooth.
That's correct. And you're
so you don't lose that one, you were saying.
That's
right?
correct. So that's a fixed option. The other fixed option is a dental implant, which we've covered in the past. A dental implant is one of the best options we have in dentistry. We're literally placing an artificial root right down into the bone and gums, which is a titanium root, completely good for the body, very safe. And I'll tell you, it could be better than the rest of your teeth in your mouth. I mean, they're that predictable. 98% success rate, an amazing technology that really replaces teeth to as close to nature as possible. And then the last really option is a removable type of appliance, whether it be a full upper denture or a partial denture. If you have several teeth that are still there and you only have a few teeth that are missing, we can actually make an appliance that will replace those several teeth or a few teeth. Removable is always my last option. It is nowhere near as good as fixed. You're not going to be able to do the things that you used to do, with your fixed teeth. And like we talked about it before, John Hopkins, one of my favorite little stats was out of the 10 top things that you should do to be a healthier person, number 4 is if you have dentures, you need to have dental implants to help either replace those dentures or secure them. It'll literally get you from And
the reason you need to do that is so you can
properly chew. These appliances that are removable, they're not stable. I mean, you can live with them, but you can live with, you can live.
Digestion begins in your
You got it.
Mouth.
You got it.
Right?
I mean, that's it. So, Marcia, like I said, I would highly recommend getting back to U of M. I know that's where you had the treatment done. They will advise you on all of these different options. Again, me not looking at you, I'm not sure what kind of a candidate you are, but they're going to be able to educate you, and it will be a very good thing for you to get things replaced, get things back on track, and start living your life again.
Okay.
So thank you for the call. We appreciate it.
Now, Jeff, you got about 14 minutes to cover your topic. How fast can you talk?
You know how fast I can talk. Very fast.
He's like a machine gun, man.
Well, okay. Let's give it a little recap from last week, okay? We talked about children who were being treated from an orthodontic standpoint, meaning whether it be braces or there's, you asked if it was just braces. It's not just braces. We're talking about preserving space in the mouth or making space in the mouth, and we can do that
while their growth plates have not been fused.
Correct. We got to work with their growth. We have to use these growth opportunities to get a person back on track. Now, why would a child maybe not be on track is really what we didn't get to last week. And here's some big causes of problems in development: thumb sucking, or any type of digital habits, sucking on their fingers, biting in nails, and things like that. Tongue thrusts. You've heard of children who kind of sit there and their tongue's kind of hanging out of their mouth, right?
Yes.
Or when they swallow, their tongue, because of maybe a poor airway, their tongue is being pushed to the front of their mouth. Well, that pushes on teeth. We talked about how powerful.
Well, that was amazing. Last show, you talked about the tongue moving teeth around.
The tongue is a very powerful muscle, and when it's not in a stable position due to blockage of airway, large tonsils, bad habits, it can move teeth around, and always in a bad way, okay? Airway problems, which is, we just segued into that. Mouth breathing, snoring, big tonsils and adenoids, okay?
So these are serious health problems.
Very
for
serious.
your children.
Oh, there's no question about it.
That causes problems when they're 50 or 60. I could foresee heart problems, any cardiovascular, anything like you said, Jeff. Oxygen is king.
Right.
Right?
No,
so
right.
If you're not getting oxygen, you have a whole onslaught of diseases in the future.
These are children
that can be prevented when they're before they're 12.
Correct.
It's
Correct.
Urgency.
It is. Well, it's something
really
that
to get.
If you,
I really wish I would have been more aggressive with my kids, because they're older. They're past. They're 12 years old now.
It's not that they're past the point of no return by any means. It's just the question of, could we have avoided more invasive treatment? Could we have avoided extensive orthodontics? I mean, we literally can actually avoid kids even having to go into braces if we intervene early enough. And most importantly, as long as they're getting addressed, I mean, even if it's a little bit late, address it, because these children are our future TMJ patients. They have TMJ disorders, pain patients, headache patients, sleep apnea patients. These are all the people that I deal with. You know, that's a huge focus in our practice. You know, for those of you who want to get educated at least on some of the things we're even talking about, please take the time, if you'd like, go to our website at rochesteradvanceddentistry.com, or you could call our office at 248-656-2020. One of the huge focuses in our practice, obviously we're dentists, but we pay attention to a lot of things a lot of dentists don't pay attention to, and that is TMJ problems, big headaches. I mean, we treat people with pain, jaw pain, headaches every single day. Sleep apnea problems, snoring. I mean, snoring. Those of you who are listening, you're up late probably, okay, and maybe you are the biggest sleeper. When you do, have you ever been told you snore? Snoring is not one of those things that we just, yeah, I'm a snorer. It is a pathological condition.
Yeah.
And most likely,
if
you're snoring,
it's
very serious.
Something you want to address.
No question about it. And so, when we talk about all this, and we've talked about that so much in the past about adults, I'm sure that the majority of our listeners here are parents. Let us help your children. Try to, especially people who are talking about right now who have a history of sleep apnea, TMJ problems. Your child, this is all genetic. Okay, these are body types. If you've got a bad bite and you are suffering from headaches and jaw pain, or have had snoring and sleep apnea issues, there's a very good chance that your child's going to have that, because it's all genetic. And so why don't we intervene early with your children to avoid the suffering and the quality of life that you unfortunately are not enjoying right now, because they didn't know better back then. I mean, back then we didn't have the technology, we didn't have the equipment or the knowledge that we do now, which is intervene early. Okay, take care of these children early. And what I want to make sure we get to tonight is I want to give some red flags that parents can look for. They can literally look in the mouth. And you don't have to be a dentist or a doctor to understand or identify some of these things that may be a problem. And if you're even unsure, but you're like, well, maybe that's a problem, let's get them to the right person. Again, if you're in our area in Rochester, I would be happy to see them. Give me the opportunity to take a look at them. We do not only analysis of their teeth and the way their bite comes together. As you've talked about before, a lot of times we take a 3D image of the patient so that we can see things that nobody else can see. And it will tell us, yes, your child's growth is behind. His development is hindered, or she's hindered. We need to get them back on track. And here's how we do it. And there's very easy ways to do that.
So in these easy ways, Jeff, are appliances you're talking?
A lot of them are appliances. A lot of them are even less than appliance, more of space maintenance type things. But to a degree, yeah, almost like a retainer.
Now, Jeff, okay, so you have what type of kids can afford this? Is this just
most children don't have jobs. We're hoping that the parents can. Okay. But that's a good question.
I mean, really, how expensive? You don't know how many times I've referred somebody out to a patient and they're like, whoa, I can't believe it was $450 for the first visit.
Right.
And then every test, and then $3,000 worth of tests.
Of course.
Before we get started.
Of course.
And then in the treatment, that's $10,000. So how expensive are the appliances? How painful? How are the kids receiving it? Are they going to accept it? Like you said, sleep apnea, very low compliance. Right. How compliant, how painful, how expensive? Bottom lines.
That was like 10 different questions. Holy moly.
And you got 30 seconds.
All right, here we go. Well, first of all, when you're talking about the thousands upon thousands of dollars, you're really out of the ballpark, okay? We can address these things. And each child's different. Each person's different, okay? But let's put it to you this way. When you, I guess, intervene at that stage in the child's life, not only is it relatively, I mean, it's an investment, of course, in anything, but it's relatively inexpensive. But more importantly, I think you said last week, you said your child was in braces and it was costing them like $6,000, right?
$6,000, yeah.
Think about it this way. If you were spending a few hundred to even, let's say, $1,000 now, okay?
Oh, I would spend it now.
And then even avoid that.
Right. If I could have spent $1,000 when he was 12,
right,
and not $6,000 when he's 14,
exactly, and then
15, and you get less results.
Well, that's the most important thing. Not only are you going to be saving money, but you're going to be doing the best thing for your child because they're going to develop properly. You're going to have a better end result where your child, and I'll segue into your next question, which is how well received is it for the children? At that age, it's very well received. I mean, they don't really have a choice. We're cementing little things in their mouths, and they're fine. Kids are, you like to use the word malleable. Kids are malleable, okay? These kids adapt like you wouldn't believe. These are not painful at all. In fact, most kids think it's really cool. They love their, take a look. They're showing their friends. I mean, it's
show and tell.
It's like an exciting thing, as opposed to a high school student, which you're talking about.
Now it's
that's a pain in the butt sometimes.
Right.
Okay,
you don't want to be a senior.
No.
Senior pictures and have braces.
Exactly. I mean, there's a big social, a big self-esteem problem there. I mean, you don't. Again, the negatives far outweigh the positives when you wait, and you're usually either waiting too long or you're waiting to a time that's not going to result in the best facial profile and best bite that you could have if you intervened earlier. So yes, they're well received. Yes, there's an investment, but in the grand scheme of things, you're going to save time and money by letting somebody address things early on in your child's development. So, no, there's.
So what you're saying, so expense-wise, you're talking $100 to $1,000, depending on a situation.
It's anything. I mean, there's such a range. I mean,
but then your thoughts are you're going to save the $6,000 of braces. You might cut that down to like 1,000 or 2,000.
No question about it.
Right?
No question about it. I mean,
where you might still need braces, but it won't be as long.
That's correct.
As invasive.
It's what we would call like a phase 1 orthodontic treatment. So these phase 1s may mean we expand the arch.
I like that term. So that's phase 1 is before you're 12.
Correct.
And start it then.
You got it. And that phase 1 may be the only phase that they need, okay? You get them back on track. Really, in their teenage years, it may just be a cosmetic issue at that point, and that's going to be up to the parents. If they don't want to, if it's okay for them, that's all right. I'm talking about function. I'm talking about health. I'm talking about important things. You want your child to live a proper and healthy life, and you can do that if they're addressed. And the magical time, really, is like 6 to 9 years old, to be honest. That is that magical time where they have their 6-year molars in, okay? They have
6 to 9.
Yes.
Okay, I was thinking 12 before 12.
Well,
so
that is before 12, but yes.
But it's considerably.
It is. And I mean, don't get me wrong. Even at 9, from 9 to 12, there are a lot of things you can do, and each person's different. These are ranges, but we can intervene as early as 6 years old. We can intervene as early as 4 years old sometimes, and it's important. And here's some things that I want to make sure people look for, and this is a very important one. A 4-year-old. I want to talk about what a crossbite is, okay? A crossbite. For everybody who's listening, the proper bite is that your upper teeth cover your lower teeth. Okay, that's it.
Okay.
If you look in the mirror and you bite together, your upper teeth should just be overlapping your lower teeth. Now,
slightly,
very slightly, correct. Now, a crossbite is the complete opposite. And if your child bites together and their lower teeth are in front of their upper teeth, kind of like a bulldog, for those of you who are thinking,
right,
that needs to be addressed ASAP.
But that sounds like TMJ galore.
You got it.
Then eventually when he's 40, you could almost guess he's going to have sleep apnea,
big problem,
high blood pressure,
you got it,
heart issues,
everything. And these are the things where you see a 4-year-old. We can actually expand that upper arch.
It'd be nice to show the phase, a picture phase, Jeff, from 6 years old to 12 to 20 to 40 to 8,
We'll have to,
and then the health issues, weight gain, obesity.
I'll do my next dissertation on it for you.
I want to see like they showed from the apes to the modern man. I want to see phases.
I like it. I like it. I think you're onto something. But no, I mean, it's a very important thing. So when people say, 4 years old, I couldn't imagine my child being, well, I'm going to tell you, if it is addressed at that time, it could truly avoid anything else. As simple as that. 4 months. 3 to 4 months of just this little expander that will get their upper arch to get in the proper development, and then they're done. What more do you want? 4 months.
So that's called a cross bite. This under. I would have thought it was to the left or to the right.
And that
what do they call that? To me,
is.
That's cross.
It can be a unilateral cross bite, meaning one side or the other, or an overall cross bite, which is the complete upper behind the lower. And so, no, a crossbite in general, we're just talking about different things here. But, you kind of touched on if they just overlap a little bit, that's good. That's true. The other thing I want people to look at is a deep overbite, meaning their upper teeth are completely covering their lower teeth.
Sure.
That is too short, okay? And that's something that we need to get taller. And, again, there's some appliances for that. And people who have short bites, again, end up being TMJ problems, headache problems, sleep apnea problems. These are all these things we keep talking about. Here's another thing, a retruded chin. When your chin is back, okay, you think about a child.
Like Alfred Hitchcock.
Yeah, like chin's just kind of back, that's a bad thing because that means that the condyles, the TMJ joints is all
being
jammed back into the skull and it can develop into poor problems. And we can get that back on track, too.
It's just going to wear and tear faster like a tire on a car being out of place.
Right.
Right.
Well, and not only that, but their face will not develop properly. Let's forget about teeth for a second because some people are out there thinking, who cares about teeth? It's not about teeth. It's literally your face not developing properly. Your children are going to not develop properly and have their actual facial profile hindered. This is serious stuff here, And again, back to, snoring or sleep apnea. If your child is snoring right now, you better get them to an ENT and get their tonsils and adenoids evaluated because that will cause all the things that we're talking about here. If they're already snoring when they're a child, that is only going to get worse, and there's a blockage there. That is not normal. And please, for those of you who are listening, don't let anybody say, we'll just watch them. Maybe they'll grow out of it. Well, maybe they will. But maybe they won't, and then what?
Right.
We're repairing things then. So I'm not advocating surgery and saying that's the only thing because there are times where your child have allergies, okay?
Hey.
And if they have allergies, then you
Michael,
can avoid.
We just went from 5 minutes to 1 minute.
You can, if allergies are causing these inflamed tissues, then we are having problems too, and airway issues. And actually, if you go to an allergist, they can find some certain things that are bothering your children. Get those things shrunk down without surgery, which is really what I would prefer, and I think most parents would prefer too. But the biggest thing is this. If you're a parent who has a history of TMJ issues, sleep apnea, things like that, your child is going to be you. Get them evaluated as soon as possible and avoid the possible problems that they may have that you've been going through.
Sure.
How's that for quick?
I think you covered it, man. I think you covered that. So you need to get to a dentist soon to prevent, if you do have the tonsils, like you said, ENT.
Correct.
But maybe dental, there's some natural nutritional things you can do before you have them out.
Well, yeah.
If you have an appliance
or
something like that.
You just need to have your child evaluated.
Yes.
For those of you who can look at your child and look at if you have any of these issues, again, you can call our office, 248-656-2020, or go to our website, which is RochesterAdvancedDentistry.com. There's all kinds of information to educate you. Take a look at your child and just get them evaluated. It'll be a very good thing for you.
Yeah.
You'll be happy you did.
All right, Jeff. Thanks for the input. And as always, in all that you do, eat or drink, do all things to the glory of God. You can listen to all these shows on Simple Truths for Healthy Living. Have a wonderful evening. And, Jeff, I'm going to hold you to being live on WRDT that we're on at 11:30 a.m., 560 every 11.